I'm Theresa. I'm going to be your nurse today. I'm just going to make sure I have all my supplies. I have my stethoscope, my pen light, my gloves, and some hand sanitizer. I'm just going to gel in real quick. How are you feeling today?
Good.
Good. Are you in any pain?
No.
Okay, so I'm going to perform an assessment on you, and if you're in any pain during the assessment, I just want you to let me know.
Okay.
Do you know your name and where you are?
Amber, and I'm in Portland.
Okay, perfect. Do you use any assistive devices such as glasses, contacts, hearing aids, a walker, anything like that?
I have contacts and I'm wearing them.
Okay, good to know. So I'm going to give you 3 words, and I'm going to have you remember them, and at the end of the assessment, I'm just going to have you repeat them.
Okay.
So it's brown, cat, and cheese. Okay. So upon inspection, the patient is fully conscious, alert, and oriented ×3. She has clear speech. Okay. And I'm just going to have you close your eyes. I'm going to touch places on your body. I just want you to let me know where you're touching, okay?
Okay. Left shoulder. Right knee. Right elbow. Left foot.
Okay, perfect. So the sensation of your body is fully intact. Can you touch your thumbs to your fingers to your thumbs? Perfect. So the patient's fine motor skills are intact and she is able to respond to verbal cues. I'm just going to check your eyes first. So I'm going to do the 6 cardinal fields of gaze. So if you could just follow my finger. Good. Okay. And I'm just going to check your eyes with my pen light. Perfect. And again, if you could just follow my pen, I'm going to check your, or my finger, I'm going to check your accommodation. And then I'm going to check your peripheral, so again, just let me know when you see my fingers.
Yeah.
Okay. So the pupils are equally round and reactive to light, and they're accommodating. Upon inspection, the eyes are not red. There's no exudate or swelling. The cornea is transparent with no abrasions noted. Iris color is evenly distributed, and conjunctiva is clear. The sclera is also white, clear, and smooth. Have you had any troubles with your vision lately? Any
No.
changes? No. Okay, good. So I'm just going to also check the motor function of your face. If you could smile for me, and frown, and puff your cheeks, and raise your eyebrows. Good. Have you had any changes in your taste?
No.
No, good. So facial muscles are equal bilaterally. I'm also going to check the range of motion in your neck. So if you could just look to the left, and then the right. You could look up and down. Perfect. So range of motion in the neck is good. Equal bilaterally. Hair is evenly distributed with no signs of infestation or lesions. One side filled. Why is that there? Okay. Well, the head is center and erect with no tremors noted. The skull is round and without deformities. Okay, so I'm just going to put my gloves on and palpate your scalp. Just to make sure that there's no infestations or anything. No hair. Good. Ooh, sorry. Okay, so upon palpation, hair is evenly distributed and there's no sign of infestation or lesions. I'm just going to palpate your thyroid. And can you swallow for me? Perfect. So this thyroid is not felt and swallowing is appropriate. I'm also going to palpate your sinuses, your frontal and your maxillary, so just let me know if there's any tenderness. Okay?
Yep. No tenderness.
Perfect. I'm also going to palpate your lymph nodes. Good. So the lymph nodes are not present. And there's no palpable. And the trachea is midline to the body. I'm just going to feel your carotid. Good. So carotid pulse is 3 plus bilaterally. I'm just going to check your ears. So they are pink and warm to the touch. They are fully formed. There's no drainage or lesions on the ears. I'm just going to perform the whisper test. So I'm going to whisper a word into each ear, and I'll just have you repeat it for me.
Okay. Head. Blanket.
Perfect. So hearing is intact. I'm just going to check your nose. Your nose is symmetrical to your face. There's no swelling or drainage. Is there any changes in your sense of smell?
No.
Perfect. Okay. So I'm just going to have you plug one nostril and breathe. And the other side. Good. So nares are repeating bilaterally. Good. All right. So I'm going to check your oral cavity. If you could just open your mouth for me. Check. Perfect. And if you could smile. Good. So oral cavity is pink with no foul odor or signs of inflammation. Uvula is midline, tongue is symmetrical, and the lips are without lesions or skin breakdown, and the teeth demonstrate good dentition. Okay, so upon inspection, the patient is breathing easily with no loud breaths taken. The accessory muscles are not being used, and the chest inflates bilaterally. So I'm just going to listen to your lungs. I'll listen to the back first, and I'm going to place my stethoscope on the lower lungs and work my way up. When I place my stethoscope, I'll just have you take a deep breath. So if you could face that way for me. And I'll just have you move your hair. Thank you. Take a nice deep breath. So I'll just have you turn the other way. I'm going to listen to the lungs in the front. And again, I'm just going to listen lower to upper, so if you could take a deep breath when I place my stethoscope. So all lung sounds are clear. There was no signs of abnormality such as crackles or wheezing. That's okay. Okay, now I'm just going to listen to your heart sounds as well. I'm going to listen to the aorta, the pulmonic, and the Erb's point. I'm going to use this side of my stethoscope to do that, and then I'll listen to your mitral and tricuspid valves using the bell of my stethoscope. So lung sounds were heard. They were all clear with no abnormalities. Okay, I'm also going to listen while I have my stethoscope to your carotid. and also your trachea. And also take a deep breath. Good. So that trachea is loud and high-pitched sounds, and the carotid was heard without any abnormalities such as noise. Okay. So I'm just going to check your abdomen next, so if you could lay back for me and have your knees up. Do you mind if I pull up your shirt?
No.
Perfect. Okay. So upon inspection, the abdomen is pink. It is warm to the touch. There's no signs of lesions. Okay. I'm just going to listen to all 4 quadrants of the abdomen for 15 seconds. So vowel sounds are present and they are active. I'm just going to listen to your aorta for vascular sounds. I can feel it. Vascular sounds are heard. If you could just keep that up. I'm just going to palpate your abdomen, so let me know if you have any tenderness. The abdomen is soft and non-distended. You can go ahead and put your shirt down. I'll have you sit back up for me. So I'm just going to check your arms and your range of motion. So if you could just move your arm in a circle for me. Good. And your elbow. Good. And your wrist. Perfect. So the right side shows no sign of crepitus. I will have you do the same for the other side. So around in a circle for me. Good. And your elbow. Good. And your wrist in a circle. Good. So left side shows no sign of crepitus. I'll have you raise your shoulders for me. Good. So upper arms have full range of motion and strength 5 out of 5 bilaterally. I'm just going to check your radial pulses very quickly. Good. So radial pulses are strong. So I'm just going to have you hold your arms out for me, and if you could push up for me, and push down. Good. And with your fingers, I'll have you push them together, and then pull out. Perfect. So lower extremities have full range of motion and full strength. Okay, so if you could stand up for me. I'm just going to check your legs. So I'll have you take a step forward because we're just going to check your hips. So if you could move your hip in a circle. Good, and forward and back. Good, and same with your knee. That's your knee. Perfect. And same with the other side. Right in a circle. Good, and forward and back. Thank you. And can you flex your knee for me? Good. So patient has full range of motion in hips. I will have you walk to the end of the couch and walk back. Perfect. So patient's gait is steady and balance is normal. So can I have you turn around real quick? I'm just going to check your chest expansion. So I'm just going to close my fingers, and if you could take a deep breath in. Perfect. So chest expansion is appropriate. And if I can have you just dive like you're going to jump into a swimming pool. I'm just going to palpate down your spine. Spine is in alignment with no signs of masses or lesions, which indicate no signs of scoliosis, lordosis, or kyphosis. Good. I will just have you sit back down so I can check your ankles. First, I'm going to check your strength in your legs as well. So if you could just push out for me. Good. And pull back. And same with your feet. Push up and push down. Good. If you can just roll your ankle in a circle. Good. And the other side. Perfect. So the range of motion in the ankles is appropriate, and strength is 4 out of 4 bilaterally in the lower extremities. I'm just going to remove your socks so I can check your pulses. Okay, so I'm just going to check the dorsalis pedis pulse on both feet. Good. And the posterior tibialis pulse as well. Good. I'm just going to check your capillary refill. Good. And on your fingers as well. Good. Perfect. So pulses, leave your socks right there. Pulses in the feet were felt and within normal limits. Capillary refill was less than 3 seconds on both the hands and the feet. Do you remember those 3 words that I told you in the beginning?
Brown, cat, and cheese.
Perfect.